Hello everyone, welcome to my channel Ravi Static Phases. So in this series of pharmacology, next topic is oral hypoglycemic drugs. So let's introduce about how you can write university examination. So let's discuss about that. What is hypoglycemic and what is the hypoglycemic drug which is used by the oral. So hypoglycemic drugs are oral medication used to treat type 2 diabetes by lowering the blood sugar level through the various mechanisms including increasing insulin secretion, improving insulin sensitivity or reduce glucose level. So basically hypoglycemic drug is taken by the type 2 diabetes mellitus, which is like qualitative and quantitative kind of diabetes mellitus, which is occur on 45 plus age people, which is have to be insulin released by pancreas but not at appropriate level or that time for enhancement and releasing of insulin into the glucose into the blood circulation level or systemic circulation. So oral route is best for reaching the systemic circulation, and sublingual route is also best option for the hypoglycemic drug for reaching the systemic circulation. It is very appropriate for that. So example of oral hypoglycemic drugs are, first is Begonides. Begonides is metformin is taken by the hepatic glucose production for gluconeogenesis and improve the insulin sensitivity in peripheral muscles. So basically it works on the skeletal muscle to reduce the glucose level and into the systemic circulation of the skeletal muscle. Next is to be sulfonylureas drugs, oral drugs, which basically it stimulate the insulin secretion of the pancreatic beta cells by binding the SUR1 receptor by closing the KATPase channel. So basically it present in our islets of Langerhans, which is the cell of our pancreas, and it will be promoting and facilitate the function of the pancreas to releasing insulin during the ingestion of the food and reduce the glucose level into the systemic circulation. Next is to be megalitinides. These drugs are similar to SUV's insulin secreto but faster acting, closing KTPase channel to stimulate rapid intimate insulin release. So basically it is a rapid action so into the into systemic circulation. And comparing to the metformin and sulfonylureas, these two drugs are reach out the systemic circulation is very less, but the megalitinides are very fast so action into the systemic circulation and promote and facilitate the insulin function and reduce the blood glucose level. Next is to be DPP inhibitors. So DPP inhibitors inhibit the enzymes, the breakdown, the increasing hormones, the GLP, leading to increased insulin secretion and reduce the glycogen in glucose dependent manner. So these DPP inhibitors, which this is based on the enzyme production. So that is the endocrine gland, which is pancreas. So promote the enzyme to produce insulin too much and promote prevention of autoimmune disorder of the beta cells destruction. So that prevention that will helpful to production of insulin in a good manner and reduce the glucose level into the systemic circulation. So let's discuss about what is the pharmacokinetics action if of three medication into the body. So let's discuss about this. The first is metformin. Metformin is absorbed rapidly if they are reaching the systemic circulation and from the small intestine peak plasma concentration in 2 hours and not metabolized in the liver and excreted enhance the kidney. So metformin drugs are taken by the both of the patient who have like more than 45 years of age and there is viability is 100% and the first pass metabolism which is occur in our liver, so that not so that is reached out into the systemic circulation and excrete out via kidney. So it is viability is 100%. Next drug is to be sulfonylureas. It is excessively bind to the serum protein albumin metabolized by the liver and excreted by the kidney short-acting glipizide to long-acting chloropromidide. These sulfonylureas that stay long as much comparing to the metformin into the body, and there's viabilities comparing to the metformin is to be less, and chloropromidide is to be promoting the facilitate the action of the insulin into our body. Next is to be DPP4 inhibitors. That is rapidly absorbed. Lingitapine is primarily eliminated via the hepatic system, while other sitagliptin are largely excreted unchanged in urine. So these DPP inhibitors, which is excrete out by kidney without changing their own route and facilitate the enzyme action of our pancreas, which is islets of Langerhans and which is unchanged form. So if you are taking too much this kind of medication, so there is some side effects occur in your body. Make sure you have taken this medication before consultation of the doctor. So side effects occur in the metformin is to be diarrhea and nausea, to be son, vitamin B12 deficiency because it will be facilitate of rapid absorption into the intestine. So deficiency of the vitamin 12 is to be son that. Next is to be sulfonylureas. It give rise to increase the weight and also increase the edema or also sometimes show the cardiac failure. And DPP4 inhibitor side effects is to be headaches, dizziness, and nausea. So that is the oral hypoglycemic drugs that you can take by before after the prescribed of the doctor consultation. So you have to write university examination. Thank you.